Are your kidneys aging faster than you are? 7 things to know after 50. Most of us rarely think about our kidneys. We think about our heart. We think about our brain. We worry about our bones, our weight, and our blood pressure. But quietly, 24 hours a day, your kidneys are doing an extraordinary amount of work. And as we get older, protecting them becomes increasingly important. Your kidneys are 2 bean-shaped organs located toward the back of your body, on either side of your spine, just below your rib cage. Although they are relatively small, they perform several jobs that are essential to life. They filter waste and extra fluid from your blood. They help maintain the proper balance of water and important minerals in your body. They help regulate blood pressure. They help your body make red blood cells. And they help activate vitamin D, which is important for healthy bones. So today, we're going to look at 7 things you should know about your kidneys after age 50. And some of them may surprise you. Number 1, your kidneys change as you age. Like other organs, the kidneys can undergo changes as we get older. Blood flow to the kidneys may decrease, and their ability to filter the blood may gradually decline. But getting older does not automatically mean that you will develop kidney disease. Many people maintain good kidney function well into their later years. The important point is that age can make the kidneys more vulnerable to other health problems, and that makes prevention and early detection especially important. Number 2, high blood pressure can quietly damage your kidneys. High blood pressure is one of the major causes of chronic kidney disease. Your kidneys contain many tiny blood vessels that help filter your blood. Over time, uncontrolled high blood pressure can damage those vessels and make it more difficult for the kidneys to do their job. There is also a two-way relationship. High blood pressure can damage the kidneys, and damaged kidneys can make blood pressure more difficult to control. This is one reason regular blood pressure checks become so important as we age. Know your numbers. And if you have been prescribed blood pressure medication, take it as directed and discuss any concerns with your healthcare professional. Number 3, blood sugar matters too. Diabetes is another leading cause of chronic kidney disease. When blood sugar remains too high over time, it can damage the tiny filtering structures inside the kidneys. You do not need to wait until you have symptoms to pay attention to this. If you have diabetes, prediabetes, or a family history of diabetes, ask your healthcare professional how often your blood sugar and kidney function should be checked. Managing blood sugar isn't only about preventing diabetes complications. It is also part of protecting your kidneys. Number 4, dehydration may become more important with age. As we get older, our sense of thirst may become less reliable. You may not always feel thirsty even when your body needs fluids. The kidneys also become somewhat less efficient at conserving water with age. This means that older adults may be more vulnerable to dehydration, particularly during hot weather, illness, vomiting, diarrhea, or periods when they are not eating and drinking normally. For many people, water is an excellent way to stay hydrated. But more is not always better. People with advanced kidney disease, heart failure, or certain other medical conditions may actually need to limit fluids. So your fluid needs should be individualized. Number 5, be careful with over-the-counter pain relievers. This is one that many people don't think about. Certain common pain medicines called non-steroidal anti-inflammatory drugs, or NSAIDs, can affect blood flow to the kidneys. These include medicines such as ibuprofen and naproxen. For many people, occasional use as directed may be appropriate. But frequent use, high doses, existing kidney disease, dehydration, or certain other medical conditions may increase the risk of kidney injury. Just because a medicine is available without a prescription doesn't mean it is harmless. If you regularly use pain medication, particularly as you get older, discuss it with your doctor or pharmacist. And make sure they know about all medications and supplements you are taking. Number 6, kidney disease may not give you an early warning. This is extremely important. Early chronic kidney disease often causes few or no noticeable symptoms. You can feel perfectly well while kidney damage is developing. When kidney disease becomes more advanced, some people may notice swelling in their feet or ankles. They may notice changes in how often they urinate. Some people develop unusually foamy urine. Others experience persistent fatigue, itching, muscle cramps, nausea, difficulty concentrating, or shortness of breath. but these symptoms can occur for many different reasons. They do not automatically mean that you have kidney disease, and the absence of symptoms does not guarantee that your kidneys are healthy. That is why testing matters. Number 7, ask about 2 important kidney tests. One of the best ways to know how your kidneys are doing is not to guess. It's to test. A blood test can be used to estimate your glomerular filtration rate, commonly called your eGFR. This gives your healthcare professional information about how effectively your kidneys are filtering your blood. A urine test can check for albumin, a type of protein. Healthy kidneys normally keep most albumin in the blood. When the kidney's filtering system becomes damaged, albumin can begin leaking into the urine. Together, blood and urine testing can provide important information about kidney health. This may be especially important if you have diabetes, high blood pressure, heart disease, a family history of kidney disease, or other risk factors. So how can you protect your kidneys? Start with the basics. Keep your blood pressure and blood sugar under control. Stay appropriately hydrated. Eat a balanced diet and be mindful of excess sodium. Stay physically active. Avoid smoking. Use medications responsibly. And don't assume that supplements or herbal products are automatically safe for your kidneys simply because they are described as natural. Most importantly, know your risk. If you are over 50, particularly if you have high blood pressure, diabetes, heart disease, or a family history of kidney problems, kidney health deserves a place in your regular healthcare conversations. Your kidneys may be small, but their effect on your entire body is enormous. Protecting them is one more way of protecting your independence, your energy, and your health as you age. I'm Dr. Rose. If you found this information helpful, please subscribe and share it with someone who may need to hear it. And remember, healthy aging isn't about fearing what happens as we get older. It's about understanding our bodies and taking better care of them. This information is for educational purposes only and is not a substitute for medical advice, diagnosis, or treatment from your healthcare professional.